There are four horsemen of the mental health apocalypse, which are driving everything from dementia to depression. They are brain fats, methylation, glycation, and oxidation. Methylation is to do with B vitamins. When you lack them, you get impaired methylation, you make brain toxins. It also damages the arteries, and your homocysteine level goes up. Here's how it works.
Food protein contains an amino acid called methionine, which turns into a toxic amino acid called homocysteine, en route to making SAMe, which is the good guy, a methyl donor. The dots here are the methyl groups. They help make neurotransmitters and phospholipids, control genetic expression, even repair DNA. Where do the dots come from? The answer is food, folate. It's a B vitamin rich in greens. You also need B12 and B3 and B2 and B6.
Homocysteine is a biomarker for 100 diseases, including almost all brain-related diseases. Generally, homocysteine goes up when you age, but you don't want it to, because once it's above 11, you've got accelerated brain shrinkage. In the US, 40% over 60 have homocysteine above 11. In China, men over 60 are averaging a level of 15. In the UK, we don't know exactly, but we know 2 in 5 over 61 have insufficient B12 to prevent accelerated brain shrinkage, which is key to keeping your homocysteine level down. Now, homocysteine is not just a marker, it's actually causal, in the sense that if you increase B vitamins, you lower homocysteine, you reduce the rate of brain atrophy, shrinkage, and you improve the clinical dementia rating, or CDR. That's the best measure of an actual clinical effect. In studies, B vitamins alone reduce brain shrinkage by 52%, but if given to people with sufficient omega-3 DHA, by 73%, while the latest anti-amyloid drugs have actually increased the rate of brain shrinkage by something like 20%. So it's very important not to forget your vitamins and omega-3. The two work together. In relation to clinical dementia rating, those given omega-3 with a decent intake of B vitamins, lower homocysteine, have about 3 times more effect than these anti-amyloid drugs, the last 2 trials of which have reported 7 deaths and at least a quarter getting brain bleeding or swelling. So it's really important to test your homocysteine and your omega-3, both of which are included in the DRIFT home test pinprick blood test. And if your level of homocysteine is above 10, we recommend supplementing, the effect of which should bring your homocysteine up into the optimal range. That's how you protect your brain.